Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today is Wednesday, October 7th, and it is 5 p.m. I tried to go live about a minute ago, and it was crazy blurry, so I deleted it, and here we are on take 2. Okay, so today is part 3 of a talk I started on Monday. We were talking about things you should be thinking about having to do with the COVID-19 vaccine that may be on its way to us. Monday I talked about vaccine interference and immune priming, and yesterday I talked about the genetically modified virus that they want to incorporate into your DNA as part of the COVID-19 vaccine. If you didn't see those 2 live videos, I recommend you go back on my page and find them, because today is part 3 and it'll kind of make more sense in series. Okay, so today, this information is stuff that I've shared with you before, but it was written very succinctly by a friend of mine, a medical colleague who I was very impressed by how he wrote this, so I am sharing his words, which again, I completely agree with. So, part 3, herd immunity. Herd immunity is still the best answer. Most people will get mild or asymptomatic cases and develop natural immunity, including a proper T-cell response to this virus, which will be much broader and much more long-lasting than any immunity one could hope to obtain through a vaccine. Okay, so the concern is when they're doing this vaccine, they're requiring a double dose, 2 shots, because the first one isn't enough to create antibodies. And there's a possibility that you may have to get a booster in the future. That does not happen if you develop natural immunity. So the big question is, how do we get an asymptomatic case of COVID-19 naturally to develop immunity? Now, that said, rewind and listen to me. Please understand, I am not telling you to purposefully go out and get yourself infected with COVID-19. Okay, I'm not saying that, so listen up. I'm saying, how do you get yourself to have a mild or asymptomatic case should you get exposed? So what kind of things can you do in preparation, and if you are exposed, to minimize your symptoms? Okay, so first thing is that, and we're going to continue this tomorrow, so I'm not going to share everything today. The first thing is wear a mask. Yeah, okay, I said it. I know it's very political. I know some people have all kinds of issues, but listen up. Understand that this is something I learned recently. Before mask mandates were made internationally, there was a 40% asymptomatic rate. Okay? Early this year, when the meatpacking industry was ordered back to work, they required 100% mask compliance. Okay? The same was true in prisons and, of course, for healthcare workers as well. Now, in these populations, full compliance is guaranteed. So data collection in those areas is extremely valuable and something that should be looked at for other areas in regards to wearing a mask. Now, what happened to the asymptomatic rates of COVID? Surprisingly, but in reality, a good thing happened. These numbers actually went up. Okay, now that sounds like, okay, Carla, you just contradicted yourself. The numbers went up. No, the asymptomatic numbers went up. Okay, in the meatpacking facilities, it went up from 40% to 80%. Okay, now that doesn't mean that they doubled their numbers of COVID cases. What that means is that when they randomly tested these people, went from 40% who didn't know they had it to 80% who didn't know they had it. So in prisons, it went up to 90%, and in healthcare workers, it went up to 95%. So again, this is not the total number of cases. This is the percentage of positives without any symptoms. Now, clearly, the symptoms are is making people sick and is what is basically killing people. So you want to be the one, if you are going to get positive, you want to be the one who has few or no symptoms. So if the relative number of cases are staying the same, how are many more people asymptomatic? Okay? The concept is quite simple. The lower the viral load that enters your body, the easier it is for your immune system to respond and get ahead of the infection. Okay? It is easier to defend against 50 invading soldiers than 5,000 or 50,000. Okay? So a huge viral inoculum, meaning an exposure to a large viral load, requires a huge immune response. And it is that immunologic storm, that cytokine and bradykine storm that your body mounts, that is the primary cause of hospitalization and death due to COVID-19. So even though masks may not be 100% effective, and I have plenty of people sharing with me articles, see, people still get it. I understand. I'm not putting a steel thing over my face and expecting nothing to get in. But if I wear a mask and you wear a mask, less virus can go from one person to the other. Okay? So clearly they are quite effective in creating mild disease if you are exposed and still develop the natural immunity that your body needs to fight this virus. So again, I can't emphasize it enough, wear a mask. If you don't agree with me and you make a comment that, I don't like, I'm sorry, but I will delete it. Let's keep it clean. Let's keep it positive. Again, if you don't agree, scroll right past. There are plenty of other people who are posting on Facebook. You don't have to bash me and tell me how stupid I am or that I'm a terrible doctor making all these horrible recommendations. This is my page and my opinion. So, but with a lot of science to back it up, so just saying. So on that note, stay tuned for tomorrow because we're going to talk about some other things, including supplements, which I've mentioned before, which will help put you into that asymptomatic group of people should you get exposed or infected. And that is what you want. You want your body fighting strong and giving you the ability to get through this infection as easily as possible. So I hope you guys are having an awesome day. I will see you again tomorrow for part 4 for another Live in 5.